Joining us now from Scout is Matthew Sowards. He is Chief Innovation Officer. Welcome, Matthew.
Thank you, Perry. My name is Matt Sowards. I'm the Chief Innovation Officer here at Scout Clinical. I've been with the company for more than 12 years and helped stand up our Scout Clinical offering originally. Ultimately, we handle the payments, any of the travel, and then the 24/7 live participant support that makes payments and travel actually work so that patients stay enrolled and participate in your trial. The important part to understand with all of this that all of us deal with every day is that support only works when it's actually getting used. It's easy to get the services lined up. You have lots of options for that, as we're seeing today, but it matters once patients can actually get access to the system, they're actually using the system, sites are using the system, and doing that in a way globally that sites and patients are actually want to use. Ultimately, we spend a lot of time getting contracted, building budgets, looking at what needs to get done, scoping it country by country, site by site. But until sites actually engage with the system, until patients can actually use the system, it really doesn't make that much of a difference. So there's 4 easy bits here that Scout engages in to try to make this happen, to try to get sites and patients actually using it. The first is getting buy-in before launch. That means talking to each of the sites and finding out how they want to use our services. This is going to vary from site to site to site. It's going to vary country to country. And in some cases, it's going to vary patient to patient. That means working with the sites with the workflows that they're used to using. Sites in France mostly don't want to use an app. They want a piece of paper that they can put in the mail and somebody collects it and makes a reimbursement. That's fine. That may not be the way that all of us think that should happen, but it's the way they want to work, and so we make it work that way. Same thing for sites in Spain. They want to be able to pick up the phone and call and schedule a taxi. The reimbursement part doesn't matter that much to them. That's just how they want to work, and so we work with them on in the way that they want to work. The tech is a key part of it, but at this point, a fancy app is table stakes in the industry. You want it to work, you want it to be easy, and in a way that doesn't need an explanation. You've got to have that. And then the last bit is that engagement can't drop off. This can't be something where we engage with the sites initially, we engage with the patients initially once they get enrolled, and then we disappear. When that happens, patients forget, sites forget. Patients don't always need support with every single visit. Change in life circumstances may happen halfway through the trial that causes them to need travel support when they didn't originally, and they still need to know how to get a hold of you and get that support scheduled. I've got a poll question here that we'll pause on for just a second. I'm just going to keep us moving here. The managing costs are a realistic part of every trial. When we set out to build Scout, one of the things we clearly understood is that the way that these services have traditionally been paid for and the cost managed doesn't work for the average trial. So we built something completely different. Instead of having costs that accrue on a monthly basis for technology, for hosting, for support, for project management, we built something that was based on a transaction level spend so that when patients are actually using the service, sites are actually using the service, and you're getting the actual benefit of patients and sites utilizing the services, that's when Scout has fees associated with their work. And when you don't, when the trial's struggling to enroll, when things are going slowly, you're going to see much less of that from Scout. So that flexible cost structure means if you need payments, we're providing payments. If you need travel, we're providing travel. If you need neither of those things because no patients are enrolling, you're not going to see any costs for any of that. There's no idle spend. If you don't need Scout, if something happens, you get a delay, you're undergoing a protocol amendment, for whatever reason, there's recruitment challenges and patients aren't recruiting, something like COVID happens. Hopefully we never deal with that again, but it was a reality of our lives just a few years ago. You're not going to see Scout charging fees for just sitting around waiting for something to happen. And then the last bit is full transparency. We have full access to the system for sponsors, for your CRO partners, for the sites, so that they can log in at any point and see exactly what's happening on the trial. What was the individual meal reimbursement for patient 1, 2, 3, 4, 5 at their site in Spain? What was the taxi fare for the Brazilian site? What was the airfare for the Argentinian site? Whatever costs you want to see, you can see in detail. That 24/7 support it's critical. Again, the technology enables patients and sites that want to use the technology, but in some cases they just want to pick up the phone. Some sites just want to be able to send an email, and being available in their local language 24/7 without any extra bolt-on costs or extra service fees for providing that kind of service. It's available, and it makes sure that when the patients are at Walmart and they're wondering why there's only $50 on their card instead of 70, they've got somebody they can talk to who can walk them through it, explain it, and help them. And again, 24/7 in their local language. That means they're getting a prompt response whenever they need it. That's true for the sites, it's true for the patients, and it's true for the sponsors. It's us proactively reaching out throughout the trial, making sure that patient is supported, making sure things are going well. If something happened, reaching out to engage them to find out what happened, how can we help, do they need help? And then it's advocating, our patient liaison team advocating on behalf of the patients to understand when things come up that weren't anticipated, how we can help them, what it will take, and then working through that, getting that process or getting that approved through the sponsor, through whatever processes we've established. I think it's easy to talk through these as general points and and capabilities, but the real life anecdotes of patients that actually have these experiences matter a lot. Whether this is a Palestinian refugee who's traveling to a UAE site with their family, and they need help with visas, they need help with airfare, they need help with travel. They don't need an app. They need somebody to talk to who's experienced this, who can help them, who can walk them through step by step of what's happening, all the way down to something more straightforward where a patient in a pediatric study doesn't like the formula that they can get at the drugstore down the street from the site, and they need something local. Scout can help with all of those things. And then obviously all of the simple things that come up, the taxi reimbursements, the meal reimbursements, the stipend payments, the tax reporting. Again, that's all the straightforward stuff. It's the extra things that keep patients enrolled and keep them moving on the trial. This part's simple. I think everybody gets this. The recruitment obviously fills the trial. It's keeping the patients engaged, keeping the sites engaged, that ultimately allows your trial to succeed. The industry isn't lacking solutions to solve that problem. You've heard about a lot of them. You're going to hear about more of them. It's the ability to actually fulfill that on a trial by trial, study by study, country by country basis. It's clear communication up front, letting the sites know what we can help with, how we help with it, how we're going to comply, how we're going to work through their local process, how they prefer to do things, but also what the rules are for the support on that trial, so that they know what's on the table and also what's not. It's that human to human support. It's our patient liaison team talking to the sites and patients. It's our project managers assigned to every single trial globally, talking to your staff, talking to your teams, staying engaged, explaining what's happening, explaining what's going well, explaining where we're having challenges, and keeping that whole team of humans supporting other humans really aligned. It's integrated workflows. Like I said, some of this is technology that we work in 110 countries. There's 110 different ways, more than that sites want to work. Sites in Japan want to work differently than sites in Brazil, who want to work differently than sites in the US, and none of them want to hear about how the other ones are doing it, and you should just do it the way that we're trying to tell you to do it. They just want to do it their way. And our solution supports all of that, regardless of how they want to do it. And then again, it's that proactive engagement throughout the trial, whether things are going well, whether things are challenging, staying engaged, staying structured, so that everything's working exactly how it needs to. I'm happy to take questions here. I appreciate everyone's time.
Thank you, Matt. I really like your model. I've heard you do this before, and it's really interesting in your set of services and support is really good. Also, your insights into global cross-cultural communications are unparalleled. That comes loud and clear. So you had mentioned this a little bit. Every country's a little different. They all have regulations that are different. How do you pull that off?
Yeah, I think the first thing is you got to talk to the people, the locals, and do it. You can't just talk to a global data privacy attorney who's going to tell you the boxes you need to check, or bankers and finance people who will tell you the financial regulations you need to check. You got to talk to the actual sites and the actual patients and find out what they want, how they want it to work. And then it's also working with individual sponsors. Each of the sponsors, we work across hundreds of sponsors at this point, more than 2,000 trials, again, in 110 countries. There's not a single answer to every sponsor in every country and every site. And so a lot of it's flexibility, and it's just communicating, working to understand it, and then implementing a solution that works for all the people involved.
So kind of a related question, and you mentioned communications a number of times, and the key to this is sustainment. How does that interaction take place at those sites to make sure you're top of mind and that is those services are sustained?
Yeah, it's a great question. So from our perspective, there's multiple ways that we can engage, and we're going to partner with our sponsors. Some sponsors and some sites prefer to keep that communication to a minimum. They've got enough to focus on. They're busy. So we're going to flex to understand that engagement model. We have some sites that we work with, let's say in MD Anderson, that they're very clear with us about exactly how they'd like to work, and we're happy to engage with them on their model. And then there's other sites that maybe aren't as research savvy, and it's going to be more frequent touch points, us reaching out in a way that suits them. Sometimes that's email, sometimes that's phone calls, sometimes it's WhatsApp, to stay engaged with them. And just we're here when they need us, but we're not going to bug them when they're not.
Well, there's a lot of time zones across the world. How do you, like, I have a problem and I'm in, I'm in Australia. How do I get help? Is there local help for me?
Yeah, there sure is. We've been fortunate that we've seen huge adoption from all across the globe, across therapeutic areas, big sponsors, small sponsors, CROs. So we have an enormous team at this point of patient liaisons that are available in Australia, in New Zealand, in Asia, in Europe, speak the local language. If you call, at 2 a.m. in U.S. time, you probably are speaking to an Australian English-speaking patient liaison. If you're in Europe and you want to speak to somebody and you call late at night in Europe, you'll likely speak to you're in Portugal, you'll likely speak to one of our Brazilian patient liaisons who will help you work through those questions. But ultimately, that 24/7 team is there because our team spans the globe.
And then a final question: I'm a trial sponsor. How soon should I start thinking about this and the services you offer?
Yeah, I think all of us on this call are going to say the same thing. Earlier is always better. We're happy to engage as soon as the sponsors are ready. We also recognize, though, that there are lots of partners to engage, and so we have a model where we can get up and running relatively quickly. We'd love to be engaged as early as possible, but we've had trials that we've supported that have IRB submissions 2 weeks out, and we need to get docs ready and everything ready to go, and the studies stood up and ready to launch, and we've done that too. So we'll do it as quickly as we need to, but obviously we'll take the luxury of time when we have it.
Well, Matt, thank you very much for being with us today. Matt Sowards from Scout.
Thank you very much.